right, sounds great. Again, like you said, my name is Mark James. I'm one of the underwriters here at United of Omaha. And what I'm going to be talking about is skin cancer. More specifically, what you need to ask your clients, what sort of information could be helpful to really make the underwriting process go a lot more smoothly. The first question really anyone's going to ask, and I hear this a lot from many agents, is why do we care? Why is skin cancer so concerning when we're talking about life insurance? And the really basic answer to that is its prevalence in the United States. And some stats that I found from our medical director actually showed that just within the next year, they anticipate up to 74,000 new cases of malignant melanoma, one of the more concerning skin cancers in the United States, just by the end of 2015. So very common medical conditions, and really can lead to a lot more concerns in the underwriting process. So how I'm going to sort of interpret skin cancers, we're going to break it down into two separate categories. First, you have your non-melanomas. These are more of your common skin cancers. You see a lot of the clients will see their dermatologist for these. And how they're broken down into is depending on where they're located on the body. The first one, for example, is a squamous cell carcinoma, one of our more common skin cancers, and is actually potentially could be preferred plus in our own categories. A lot of other companies might agree with this as well, depending on how severe the diagnosis. Squamous cell carcinoma located in the top layer of the epidermis of the body. It's pretty much the top layer of the skin. So that's why a lot of clinicians might not be all that concerned with it, and why we in the underwriting world might be relatively okay with possible preferred considerations. Another one similar to that is basal cell carcinoma. You'll see a lot of clients who might indicate that they've had this in their time. It's very similar to squamous cell. Also very pretty much on the top layer of the skin and easily removed and possible preferred considerations. We have some other more rare types, things such as Merkel cell carcinoma, apocrine carcinoma, verrucous cancer. A lot of these a little bit less common, not usually seen. You probably won't even have very many clients who've even indicated they have a history of this. The things that we really want to know when it comes to these types of less concerning skin cancers, number one is staging. If the client knows what sort of stage that their cancer was at when it was removed, examples are like stages 0, 1, 2, all the way up to stage 4. So 0 through 1, usually the most common when it comes to these types of cancers. And for our own purposes here at United of Omaha, we'll give preferred plus considerations for those right off the bat. So very common is where they tend to fall into this category, this stages 0 through 1, but we really want to make sure that that is the case. Once you start to see some of these higher stages, stages 2 through 4, that's when we really start to get concerned. Medical records might need to get obtained at that time, and there could be potential ratings there. Now, when it comes to determining the staging, pathology reports are really the most necessary document that we could get from. Sometimes the clients will actually obtain these from their physician. Their dermatologist or oncologist might actually provide them with a pathology report. If that's something that you can obtain, I would certainly recommend doing so. That will really help with speeding the underwriting process up. Now, the most concerning thing when it comes to these types of cancers is actually that they're really notorious for reoccurring. Many clients will actually have them more than once, at least 2 times is what I've seen in my time as an underwriter. They're very common when it comes to redeveloping throughout the body. So that's actually one question you might always want to ask when it comes to skin cancer in general, really, is, have you had just one lesion or how many times have you actually had this type of skin cancer, and really when did it last occur, because that's really key, is to determine both how often they've happened as well as when. The most important thing that we as underwriters really try to look for, though, when it comes to skin cancer, is good follow-up. Especially with skin cancers such as these, where they are very, they do occur more often. They are more common, so therefore we want to make sure that they're being treated by their physician and that they're being seen by them on a regular basis. So always double check to make sure that they are being seen by either their primary care physician, their dermatologist, or even their oncologist on a frequent basis, because we really want to determine whether or not they're receiving the care that they adequately need for this treatment. Now, all things aside, that's really how we would really look at a non-melanoma case. Pretty much that's where you would sort of lump all skin cancers into that category, other than what I'm now about to discuss, which is the malignant melanoma. Very common skin cancer and also very concerning. Melanoma is really concerning in a number of different factors. One, it's actually the one that everyone always hears about when it comes to staying out in the sun too long. You hear about people with risks of skin cancer following using tanning beds. This is the cancer that they're really referring to, and this is the one that we see most often in underwriting and really just in the general population. It occurs actually in the lowest part of the epidermis, which is the top layer of our skin. That's actually why it's more concerning. It's actually based on where it's located in the body. It's on that lower end threshold, so therefore it could be more concerning to your health. When it comes to melanoma, a pathology report will be necessary on all cases, if we can obtain them. So if the client has it, that's perfect. That would definitely be the one thing I would always ask my clients, is, did the physician provide you with any sort of pathology report, or did they at least give you a staging on your melanoma? There are generally these types of cancers will actually be more of a standard risk. Once we see some stability for several years, in our own internal guidelines, we give it about a 10-year time lapse before we can actually allow possible preferred considerations. So timing is really key when it comes to melanoma. And generally, the most concerning thing is whether or not it's a relatively low stage, given its severity. So that's definitely some information that we would want to know, both when you last had it, how much treatment you've had with it, and really what the stage was, if we can determine that. The other most important thing when it comes to melanoma is actually the location. Certain parts of the body are actually more concerning than others. We see this more with melanoma than any other skin cancer. So when you determine that that's the actual cancer, try to the next question really should be where it was. Many of our underwriting guidelines really try to emphasize that, say, a melanoma located on your chest might actually be more concerning than one, say, on your arm. The reason for that is actually based on a couple other things that I'll highlight later. And when it comes to both location, then we start to talk about the size of the tumor. And the size of the tumor is actually what actually determines the staging of the melanoma. So, for example, a 5-millimeter melanoma might be relatively concerning, and the reason why is actually because then we start to think of other concerning factors, which is metastasis. Once a cancer has gotten to a certain stage and a certain size, where that it's then starting to affect other parts of the body, we call that metastasis, and it then turns into more concerning factors such as, has this cancer now spread into their lungs, into their heart? And that's actually the reason why, in the case of melanoma, why the location is key, because if, say, a melanoma is located on your chest, it's a lot easier for it to metastasize into some places like your heart, your lungs, your liver, etc., as opposed to if it were on your arm. So
I was going to, sorry, I didn't mean to interrupt you.
Oh.
I was just going to ask, a lot of times when we have agents tell us that, oh, my client had skin cancer, it's no big deal, it was about the size of a pencil eraser.
Yeah.
Is that a legitimate sizing for you? Does that work for you, or should there be another measurement they should be giving? Or if they say it was the size of a pen tip, I mean, do those measurements work for you guys with underwriting?
That should be sufficient. I mean, if we can kind of at least get that, more accurate descriptions are helpful, but at least as long as we can get some sort of idea as to the size, that can at least give us a general idea as to where the staging might be. Like I said, when it comes to melanoma in particular, we will definitely want something like a pathology report. The reason for that being just so that we can determine how severe this type of cancer is, since it is so concerning.
Okay.
So if we can at least get some sort of description of size, that should at least help with us determining a possible rating.
And do the colors, I know that's something I've seen before, do the colors of like the spots, are those concerning, or is that something that we would need to know when giving you the information also?
Generally, the color really just helps the practitioner, the physician, determine the type of cancer.
Okay.
So when it comes to the coloring, that really probably wouldn't be that much help in underwriting, simply due to the fact that the physician would then already have made a determination as to the type of cancer.
Okay.
So, and in most cases, when it comes to skin cancer, we will get medical records to determine how severe the cancer was and make sure that there is good follow-up, etc. So coloring probably wouldn't really be necessary in this sort of scenario.
Okay, alrighty, just thought I'd ask.
No, of course. And so like I was saying, when it comes to melanomas, the three key factors that we really want to address are location, the size, which is also the staging, and then also the most concerning thing is whether or not they've only had one or more. Like I said, when it comes to non-melanomas, reoccurrence is pretty common. However, when it comes to melanoma, the more you have, the more concerned we are. Any more than, say, two, we might actually not even be really willing to offer coverage, especially depending on when it, how long ago this actually occurred. So we would really want to know when it last occurred, and then also has it occurred again. Reoccurrence is very important when it comes to malignant melanoma. Another thing that's very concerning with all of these cancers, however, is actually when it comes to follow-up, many dermatologists, oncologists, but usually dermatologists in this case, will actually do follow-up skin evaluations. We see this a lot in underwriting, and even in practical care, they'll do almost an annual, if not biannual skin evaluation, or skin check is what they'll call it. And what they're looking for is they're looking for either potential skin cancers or even just lesions that might be slightly concerning. We'll see this from time to time where they'll see something like what they call a dysplastic nevus. What that means is it's just a skin lesion or a mole or something along those lines that just looks concerning, and it could be cancer, so they just remove it and just try to determine whether or not there could be potential cancer there. And dysplastic nevus is actually when it's atypical. It looks off in their eyes, and so what they'll do is they'll send it, and they'll do a pathology on it. And with the history of melanoma, if we do see a lot of dysplastic nevuses or dysplastic nevi, there is concern for more risk for recurring cancer. So a lot of times, if you do see these, there is potential for an increased rating in our underwriting. So another question that we might want to ask, if they do have a history of, especially if they have a history of melanoma, is, have you had any skin checks since your melanoma? If so, did they remove any skin lesions, moles, etc.? And do you happen to know what those turned out to be? That way we can kind of determine whether or not, whether or not there was more melanoma, or whether or not it could be reoccurring, or if whether or not these were benign, they're okay, and there's good follow-up. So again, like I said, when it comes to non-melanoma, this is the same for all skin cancers. Good follow-up is key. We in underwriting will always try to determine whether they've seen their physician since the cancer, how often, and whether or not anything's reoccurred. And with that, that's how we can determine a good rating for your clients. Any questions on any of that? I know I kind of went through that relatively quickly.
One of the questions we have is, how is some of, I know this is kind of a big question, a loaded question, but with your new changes for your Express Answers and the GUL Express, how is cancer rated with those products?
With those products, I'm not very familiar with the Express products myself. We in Fully Underwritten generally will only, since we can access things such as medical records, it makes things a little bit smoother. When it comes to Express, however, I believe as long as it's been removed and there's no real concerns of it occurring at that time, we should be okay.
Okay. And then another question we have is, what's the differences you're seeing from, years ago to now with cancers? Are you seeing more and more people with harsher stages of cancer, or is cancer more so now versus, like, say, 10 to 15 years ago?
Yeah. What I can say is that from what the numbers were showing, and just from my own prior experience when I worked in clinical care as a medic, we did see fewer. It's been relatively steady, the actual rates of, especially like melanoma, the more concerning cancers. On the underwriting side, we haven't really seen much of a change as well. Treatments are much better, so therefore we're less concerned with it. I know many years ago, from prior underwriters who I've worked with have said that it was much more concerning. Our underwriting was much more severe when it came to skin cancers. But now we tend to be a little bit more fair with it. We see a lot more melanoma cases that are a true standard, or even with possible preferred considerations. So the numbers have been stable, but our underwriting has gotten a lot better with it.
Perfect. Can I just get, real quick, I know you've touched base on this already, real quick in case anybody's just tuned in, you're sitting down with your client, and your client says, well, I had skin cancer 2 years ago. What are the first, I don't know if you would say first 5 questions you should ask to make sure you're getting all the medical information that you can before just calling us up and saying, oh, well, they had skin cancer 2 years ago, it's fine, everything's fine. What are the real quick questions for everybody to remember to ask the clients before they leave?
Yeah, certainly. I can definitely do that. First one I would ask right off the bat is, what type of cancer did you have? We really want to narrow that down. We want to make sure, hey, is it melanoma, or are we talking, something like a squamous cell carcinoma or a basal cell carcinoma, some of the more common ones. So number 1 question, what type did you have? So we know. So number 2 question I would ask normally would be, when did you have it? We already know it's 2 years ago. Number 3 question I would say is, have you had it before? Like I said, when it comes to those non-melanomas, they do reoccur quite often. So knowing how often they're occurring is key. You know, especially in the case of melanoma, which doesn't reoccur as often, we definitely want to know if they've had it in the past. And the next question I would certainly ask, if the client knows, which may not happen, many of the times, you know, clients are not aware of this, but you know, do they have to know how big it was or what the staging was? Basically the same question. You know, what's the staging, what's the size of the cancer, or what was the size, I should say. And really, the last question I would ask, actually, I take that back, 2 more questions I'd ask. The next question I'd ask is, has it metastasized to the next part, to any other parts of your body? Do you have any other concerns for any other cancers? Is how I might word that, because some clients might not know what metastasizing means. But so I would ask, you know, are there any other concerns that this cancer's spread to any other parts of your body? And really the last question I'd ask is, how often are you seeing your doctor after that? You know, in this case, they said that they had cancer 2 years ago. Have they seen their doctor since? We really want to make sure that there's good follow-up. That's really key in underwriting. So that would be the last question I'd ask.
Perfect. All right. Well, I don't see any other questions here. Anything else you can think of to add in quick, just so that these agents aren't, you know, you hear your client has or had skin cancer, and just not automatically assuming that they're not insurable. You know, anything else you think you could add in there for them?
Really, the only thing I might add, and I think I've probably said this multiple times already, but really, I just want to really emphasize this, because I know any underwriter in the business will tell you this, and they'll do the same thing, and that is good follow-up is key. Good cancer is very concerning, no matter what type, and it could be 2 years ago, it could be 10 years ago, it could be 20 years ago. We want to make sure that the clients are seeing their doctors and that they're being checked up to make sure that there's no more cancer. And that's how I can end that. That's what I would say would be the most important thing to always remember.
All right. Well, thanks, Mark. You did a great job. Really appreciate it. I don't have any other questions here, but before everybody goes, just want to say thank you again to Mark, and stay tuned for next week's Life Weekly session. It'll be on the 27th, same time, and we'll be going over the Rapid Builder IUL updates with North American. Mark, thanks again, and everybody have a great day.
Thank you.